Okay.
Good. So, this is a way of tackling a patient's local pain problems. Working at the local zone, following this pathway. However, you might be flexible enough to say, okay, nothing happened, what I treat here, I go straight to a reciprocal zone and follow a pathway like that. And you can also decide, okay, I haven't achieved any dynamics on the local zone, I go straight and work on the general zone. So this is just a guideline how to tackle a problem. It's what is called the SCENAR technology in SCENAR lingo. It gives you a frame, a guideline, how to work with a patient. Let's go to the general zones. If somebody has got problems in the neck, head and shoulders area, you would treat on the collar zone because it's close, or you would decide you go to 3 pathways to 6 points. If you've got a patient that's got problems in the spine area or an issue with the nervous system, or just general pain of the body, like for instance in fibromyalgia, then you would decide probably to go to the 3 pathways and 6 points. If there's something with digestion and abdominal issues, you would work on the abdominal zone. And if a patient has got problems with the legs or the feet, then you would go to the palm zone. However, there is no strict guideline where to use it, where to start from. However, you will find out later that 3 pathways and 6 points is always a good choice because it influences quite a large area of the body and it gives you additional information where to work next. We will cover this when we come to the dose 1 mode later in the seminar. So, there's a few new words you have to learn here. When we work on general zones, then we have got roots. And in 3 pathways and 6 points, we have got a central spinal root. We got a left and a right paravertebral root, which is not 2 as you might think. It's just 1 root. And then we have got 6 points on the face, which is another root. These are the pathways painted out on the back of a patient. Number 1 here is the central root, and we start in an area below C7. This area will not be covered with the SCENAR. We start below here, and the first root goes all the way down to the sacrum, and then you lift the device off and you go to the hairline and brush it down just above the C7. This is the central spinal root. The left and right paravertebral root is starting again below C7. You move it all the way down to here. You go to the other side, move down here, and you work from the hairline down there. And there's a certain order that I will show you, because on the spinal root, you will do the whole lot down to the sacrum, but on the paravertebral root, you divide it up in sort of 3 strokes, covering roughly 1/3 of each of this pathway, before you finally go up to the hairline and down again. And then there are 6 points on the face, which is another root, and you hold the SCENAR device in a 45-degree angle roughly, go to the mouth there and swipe it down. You go to the maxillary part, swipe it downwards, and you do the same from up here and either leave it or swipe it slightly upwards. These are the three routes of 3 pathways and 6 points. The collar zone is an area around the collar, but also includes the forehead and the projection zone of the adrenal glands. Here you would start off with this as one route, starting up there, brushing downwards, lifting off, setting it on again, brushing downwards, and do this in this manner before you go to the other side and brush down like that over the neck and shoulder area. Then you would go to the forehead, and from here you brush sideways all the way over the forehead on one side and on the other side. And here is just one position where you hold the device and swipe it. I will demonstrate all those things later on. This is just a description of all the general zones. The abdominal zone is, of course, on the belly, and here we leave free an area vertically and horizontally through the belly button. And from here, we have got the possibility to brush in different ways there. We can start on the inside, go downwards, like that, and then go to the other side like that, or we can start from the axilla line and make our way to the center, and from here we can go this way, or we can start again at the axilla and go down here. And of course in the lower part as well. Usually you would choose 2 quadrants in an abdominal zone that are either opposite like this, or this and that, or this and that, and this and that, or just the lower ones, or just the upper ones, when you do an abdominal treatment zone. The palm zone is named because you would use the palm of the patient in order to find your treatment zone. You would ask the patient actually to put the hand in front and in the back, and then marking the outer markers here, that gives you the treatment zone. And here you brush again from top to bottom all the way and cover the whole area. You do the same thing on the back. And additionally, in the palm zone included is C7, just one position where you swipe down, and SSN is abbreviation for the suprasternal notch. That's that little groove just above the sternum. Okay, let's go back briefly to the local zones. You outline your area where you work. You turn on the SCENAR, increase the energy level outside the treatment area to a setting that's comfortable, and you brush along with general vectors, as demonstrated before. Once you find an asymmetry, say here, then you do the 4 vectors, meaning from top to bottom, bottom to top, left to right, right to left. Then you test with your general vector again whether you have made a difference, which you sometimes feel while you're working in the 4 vectors, but if you're not quite sure, do it again. If that doesn't work, you can do the opposite or a symmetrical area in the same way that you work with general vector and the 4 vectors. Or you can try a reciprocal zone. And it's up to you to decide which one you take. That depends a little bit on where you're coming from in your therapy, whether you're a physiotherapist, whether you're a doctor, whether you're a massage therapist, or whatever modality you prefer, you have got some ideas, some intuition sometimes, that guides you as well. So listen to that as well. It's not necessarily to follow a strict order, especially when it comes to reciprocal zones, because there are so many possibilities. So if the lower back is affected, you could work on the front back, you could work up in the neck area. If you've got pain over the frontal sinus, for instance, and the eyes, you could work down here, or you can work on the back there. But usually a good idea is, or a good guideline is, to be as far away as possible as you can from the actual painful area. So any of these, or all of these, are treatment possibilities that you can actually tackle. If you have got a complaint here, then you can work with horizontal areas as well. You can get on the spine, curve around, come to the front, down here, and you hold it on the central line, and then you continue your pathway till you finish on the spine. Was that too quick? That's one method. So, to sum it up, do your local treatment, do the symmetricals, opposites, reciprocals, horizontal zones in any order that you think are suitable, and then if that doesn't work and doesn't give a change of the asymmetry, then you are actually working with general zones. So, how does that work? You mark your roots first. It's a good thing to do as a beginner, that you have got an eyebrow liner, for instance, that you use, or any other pencil that you can wash off easily from the skin, and mark your roots there. You want to follow the spine. And again, you turn on your SCENAR and you increase the energy level to a comfortable level outside the treatment area. And then you place the electrode in a vertical position on the C7 and hold it for a few seconds. And then you slide down slowly till you come to the coccyx, where you hold it again for a while. Then you lift the device off, go to the hairline, hold it there, slide it down, hold it a bit. And you do this a few times. What you're looking for is, you're looking for an asymmetry. You're looking for a place where it sticks or where it gets red, in order to concentrate your treatment on this asymmetry. And when you have got a small asymmetry, then you use your 4 vectors again till the asymmetry is actually changed. Now, you divide for the paravertebrals the back into roughly 3 sections, and start working here, and do on the left side the first third, and then on the right side, and then move downwards and do subsequently the other thirds in the same manner as before, and then go up to the neck area. And again, we do this a few times in the same fashion, holding it, moving it, holding it, till you find an asymmetry, and then work on the asymmetry with the 4 vectors. Then when you go to the face, it is important that you halve the energy level that you had on the back, because the face is more sensitive. If you want to be friends with your patients, do it. Otherwise, they jump. And then you place your SCENAR device on this position first, looking at the patient. It's from your position, the left side and the lower side. Then you go to the right side, then upwards to the left, upwards to the right, and so on. This is important that you learn this, because it's always the same. At the beginning, it might be a little bit confusing, but that's the proper way of doing it. And especially when it comes later on to using the same method, using digital methods, the dose 1 mode, then you will notice what it is for. Should we demonstrate this on a patient? Is Andreas still there?
Any questions?
Yeah.
Okay.
Do you want to be?
Me? No.
No.
Wait.
There's a question. Do you want it with a patient or not?
1 minute, please.
One moment.
Good.
One more question.
Usually, yeah. Usually they would now start doing it to show how it works. Nobody here. Will we continue? I don't know.
Some slides,
Mhm.
not right. This,
Mhm.
this.
Oh, same hand? Oh, the slide was wrong? Yeah, that's right. Yeah, have to turn it around.
Opposite.
Yeah, Yeah.
This same,
yeah,
not same.
yeah,
This,
that's
yes.
right, yeah,
More this, more this.
yeah,
And now,
yeah,
same.
yeah, it's the same, yeah. Sometimes it's difficult. Ellie made the slides. Ellie is not practitioner. Do you like slides?
Slide, good. But different information. Maybe not correct, maybe not right. A little later, I remember.
Okay. Slide presentation. Okay. Sitting on stand,
Yeah, sitting would be good, but do we have a,
but we hasn't,
we need a good chair for it. These ones are not good.
it's not good chair.
No, no, I can't. We'll see whether we find another chair.
Можно сесть на стол, я думаю.
На стол тогда придется выключить
Нет.
проектор.
Ну, а зачем нам проектор сейчас?
Это не так просто.
Потом, не дай бог, мы его не включим.
Рит. Вот так вот поставил, и не надо ничего выключать.
Да,
Чё?
да.
Ну вот так вот, давайте.
Держи.
Yeah, then I can't reach. Ich komme nicht richtig dran an dich. Das ist blöd.
Вот дальше.
И придется снять цепочку для поворота.
Кадуцеуса. Моего кадуцеуса.
Давайте.
Это не слепит, это сам.
Хорошо,
So we need some sort of chair where you can sit on.
No chair.
Stool, something like that.
Yes.
It's a box.
Так,
where we can sit on.
а почему на стол не сесть? На стол. На стол. Вот.
Садитесь на стол.
На край стола.
На край стола.
На край стола.
Сядьте,
Прямо вот так.
Oh, okay, good. Okay, kannst richtig drauf sitzen, glaube ich.
Вот так лучше?
Sieht stabil aus.
Свет.
Okay.
Так не лучше, но как слишком такой материал. Ja, ich bin schon viel gut sagen.
Kannst du den Gürtel vielleicht ein bisschen aufmachen, dass nur so richtig da ankommt?
Холодно.
Good.
Садитесь.
А я обещал стриптиз, пожалуйста.
Okay, ready to go? Good. Okay, now this is a demonstration of dose 0 mode, the 3 pathways and 6 points. So we will be working in this area here. We want to see where his C7 is, because that's the area we don't want to treat. So I'll just get myself a pencil. In order to mark this. So in order to find where C7 is, you put your hand down there and ask the patient to move his head down and up again. Now, when doing this, you can feel one part is moving and the other part of that prominent lump here is actually still. Now, the still part is T1 and this is C7. So we actually want to stay in the middle area here. Doesn't work. And this basically is the area of C7 that we don't want to work on. Up here. So we start down here and work all the way down here. Usually, when you do this, it is good practice that the patient is sitting as he does now, because then you've got the full load of the spine actually while he's sitting. It's not a good idea to lie them down. Sometimes it's even uncomfortable for patients to do so. So next thing is I go outside the treatment area, put my device on his skin and ask him to tell me when he feels a comfortable tingle. I'm turning up now. Tell me when, please.
More. More. Enough.
Enough?
Yeah.
Good. Okay, we're now at 46. So now we start putting the device on here, holding it, and following the outline of the spine. Now he has got a straight spine. If you're having a patient with a scoliosis, you have to follow the outline of the spine. I'll show you a slide for it. So you hold it a few seconds, and then you start moving it downwards. And this is a good speed with an equal pressure that you want to apply. And here we've got the first symmetry. The device is sticking. And here it's easing and goes a little bit easier. We come down to the spine here and hold it like that. Still okay?
Yes.
And then we do it again. So, and again, when I come to this area here, it's really sticky. So I found my first asymmetry here. Moving it all the way down, holding it. And now that I know there is an asymmetry in this area here, I start working on this. Going from top to bottom, bottom to top, and going sideways. And the most sticky is from top to bottom. So it is a little bit more often. Till I see it's easy a little bit. And now you can see it's getting a little bit red. But it's easier to move than it was before. Next point is, so I go to his neck area, to his hairline, better said, put it on there, and move it downwards till I get to my mark here, that marks C7. And I do this a few times. Sometimes you've got patients with less hair, and they can start higher, and you can really get sort of 2 electrode lengths to do. Sometimes you've got patients who've got a shorter neck. You can just place the SCENAR in there, and sometimes the neck is so short that you have to actually twist your SCENAR device sideways in order to get to the point. And again, here it's rather sticky. So I do my treatments up, down, down, up, in order to resolve this a little bit. And it's getting a bit easier. Again, the top to bottom was the most sticky one. Okay, now I want to go to the paravertebrals, which, if you have got your SCENAR electrode like this, in the center part of it, you actually go leave a gap of 1 electrode width to the side. So basically, you want to be here. And roughly, you want to do 1/3, then the other side, another third, and then the last third in both directions. So you put your SCENAR device on here, move it, hold it for a bit, you move it down, you hold it a bit, you go to this side, you move it, you go to this side, hold it, and again, this is very sticky in this area up there. Very sticky in this area too. How's the sensation? Is it still okay? No changes there. And we start at the top again. So after going over his skin twice, I already know this area here is where it is very sticky. So I now work on these asymmetries. So that it goes easier. And the same I do on this side. It was already resolved already. So this was the main area, and as you can see, there's a difference in color already. It's more on the left-hand side than it is on the right. Okay, now we go to the upper neck part. Again, put the device on there, drag it down. On this side. And this side is easier than it is on this side here. We're coming into a sticky area, so I do the same thing. And this time going upwards is the most sticky. So I focus on this one a little bit more. Till it resolves, so it's a bit easier now. And as you can see, we started scratching his upper arm here. There's something happening as well. Something is resolving, which is most likely connected to the asymmetry up here. So it's gone. Juckt's noch?
No,
Good.
bisschen.
Bisschen. Okay.
Well, but
Yeah. Yeah, that's much easier now. Yeah, it's getting sticky now. Okay. So, much easier. There was the second of the roots, and now we have to turn him around in order to get a face done. Want to sit on the chair? So as I said before, turn down the energy by half. So I go now from the 46 that I had before to the 23. And standing behind you. I start off here, and I give with my hand a little bit of a steadiness of the head. Hold down the electrode like this, and wipe it down like this. And I do this a few times. And I go to the other side. Is it okay?
Yes.
And then we go like this, up here. The other side. And here. And up here. So, and on all 6 places I've been, it all feels the same. There's no stickiness there. There's no discoloration in his face. And that concludes the 3 pathways and 6 points in dose 0 more. Thank you very much. How do you feel now?
Really
Good?
very good.
Yeah. Might get tired again.
Feet
Good.
really better.
Okay, let's move on to the collar zone. The collar zone, we apply the same principles as I've just demonstrated for the 3 pathways and 6 points. It's just that we have different places where we start working. So here are your roots, which are 5 on each side. You turn on your SCENAR device, you measure outside the treatment area how the comfortable energy level is on the patient, and you use this, and then you start moving all along here by holding the device, sliding the device, and holding it before you lift it off and go to the next pathway. And you repeat this several times. If you find any asymmetries, basic thing, you go with your 4 directions and 4 vectors over the asymmetry, and then you go to the next side and brush along in this manner. And if you find any asymmetries, you would work on that as well. On the then you move to the front, and again you reduce your energy level to half because the face is more sensitive than the back. And you place your SCENAR device on the forehead and move sideways in this manner in order to elicit a symmetry. If you find it, you treat it with the 4 vectors. And finally, to the collar zone, you go back to the back in the area of the adrenals. And here you increase your energy level again to what it was before, and put the adrenal, this electrodes over the adrenal projection zone, and move it, slide it down a little bit. Now, any asymmetries you find there, you treat with the 4-vector method. In order to find the projection zone of the adrenals, I used to have a a slide for that. I don't know what happened to it. You'll find the inner side of the scapula that gives you the lines that go vertically, and you find the lower rib cage that gives you the horizontal lines there. Now these two lines cross, that's the projection zone of the treatments. The abdominal zone, you divide with across there the areas vertically and horizontally around the belly button you don't want to touch, and then you move your device over, say, these two quadrants. You can choose two other ones, you can choose the top one, you can choose the lower one, depending on where the complaint is. And again, increase the energy level to comfortable, place it on the, hold it, slide it, hold it. The same principle till you have covered the area. Okay, here we've got 4 lines there for a relatively slim person. You might have a person with a bigger belly, then of course the lines that you go from top to bottom increase, and you can go from the mid-axilla line all the way to the central line. Any asymmetries, again, get treated with the 4-vector method. Sometimes, or with most patients, I would think you have to hold the skin relatively tight in order to get the movements going. And but this is okay. So the palm zone, here we've got the right hand to the front and the left hand to the back. Sorry, it's not the left hand, it's the right hand. And the central part should be a little bit further over, and this one a little bit further over. These are not the same zones. It's not like cutting a rectangular thing for both there. They're slightly different to the sides. And while the patient is holding the hands like that, you mark the area and then do the same thing with working from top to bottom. Oh, yeah. Oops. And all the way down there, which is sometimes an issue. It goes relatively deep down with some patients. If you've got patients who are small and have a bigger belly, it seems to be higher because they can't reach that far around. But that's okay. It goes as far down as the pubic bone sometimes, and then you've got an issue with the pubic hair being in the way. So that might be a problem. And if you find an asymmetry, you work again with the 4 vectors, then you do the same thing on the back till you find an asymmetry, and then finally you go to C7, hold the device on there, swipe it away, see whether it's an asymmetry or not, and do the same thing at the suprasternal notch. And that gives you an idea how to work with SCENAR on these 4 general zones using the dose 0 mode. It's actually quite easy, but it needs a little bit of practice. Okay. Just turn the camera off for a second. I'm just looking for something. Sorry, I'm not very organized. Okay, here we are. Good, turn it on again.
Okay.
Thank you. Okay, now with dose zero mode, we also can treat certain areas of organ projections. For instance, the liver zone, the pancreas zone, the back of the chest. We can treat the neck area, front and back, and of course meridians. So here is a slide that gives you an idea where to treat for the liver area. This is the abdominal frontal area. This is the belly button underneath a line where the breast ends. To the side and front is your liver zone. Now this liver zone can be treated whenever there's an issue with the liver, of course. When there is an issue with digestive issues, and will be treated the same way as we would treat a general vectors area. We just projected over the liver area. The same applies with the way of treating it. You hold it, you slide it, you hold it, and try to cover the whole area in order to elicit any asymmetries. The pancreas can be found just above the belly button and covering it, and the medium maxillary line gives you the direction where to go from over here, using the same general vector technique. Interesting part is the chest. The chest margins are actually given through the ribs there at the bottom, and the top lines are the trapezius, the top of the lungs, goes over to the mid-axillar lines. And here we have got two different techniques how to use the SCENAR on it. One is actually called the lamb's techniques, or sometimes also called the clouds, where you actually do little movements there that give you the idea of lamb wool or clouds there. You start off at the neck there and you drive your SCENAR over the spine downwards, and then use little movements going down here and starting to curl along with your SCENAR device and go all the way at the outer margins up till you get to the top here, and you slide down again, and then you do the same movements on the other side. And rotate your device while you're going along there. You have to hold the skin a little bit in order to get good skin contact till you come to the top there, slide down, and the next you go to the other side again, but this time not as far as you did before. You want to try to cover the whole area by doing this, going up all the way, coming down again, till you finally cover the whole area with your curly movements there. Any asymmetries you find there, you can again treat using the 4-vector. And so you end up with curly movements and wool all over the back of the chest. And the second one is called the fir tree technique. In New Zealand, we call it the Christmas tree, where you basically go along the horizontals and move from the outside upwards, and then you come from the other side and go upwards a little bit in different heights there in order to get the picture of a Christmas tree, and any asymmetries that you find in between you can treat again with 4-vector technique. It's a good treatment method if you've got a patient with chest and pulmonary issues. It's also a reciprocal area for the abdominal complaints. And of course, if there is pain in the upper back there, which you will find quite a lot on people who are feeling stressed, having problems with their neck. A lot of people work these days with having their head down, looking onto a computer screen, working with that. And of course, you can work if they've got problems with the thoracic spine and the muscles, as I mentioned before. Okay, another good method is called the Pirogov ring, or sometimes called the neck ring, where you actually work on front and back of the neck. It's a very good method to increase activity in the immune system there, and helps a lot when you've got neck problems as well. So where you would start on this one is you would start on the usually you start on the back of the spine there, hold the device there for 30 seconds, and then do a circular motion all the way around, which is a bit tricky because you have to have good skin contact all the way through, and you move it to the front and beyond. You know, hold it for 30 seconds there, move it all the way up to the spine, hold it there, and then turn it around and come backwards. So with that method there, you do this not only once, but several times there, but make sure you've got good skin contact, which can be a little bit tricky with some people there. Variations is that you actually start at the side, move all the way along there, and hold it in different positions as marked here for 30 seconds in order to get the effect that you want to, and do this several times. It is a good idea to get the setting for the energy at the front of the neck, because it's more sensitive than it is on the back there. If you take it from the back and then move it forwards, some people actually get an unpleasant surprise. We've got other additional general areas, which is the skull. We call this the craniotherapy. You can work on the shaved skull, but some people don't like to be shaved, but you still can work with attachments there, like a comb attachment. There's a few others that I will show you. Cranial therapy is a therapy that you want to use in case patients have got problems of any neurological disorder. Patients with strokes, patients with MS, patients with Parkinson's disease, things like that. The first one here we call in New Zealand the watermelon, because you are doing movements over the skull with the SCENAR device that is like slicing a watermelon into little pieces there. So you would start at the front, holding the device there, and then move the device all the way back over the skull, holding in the neck area. Then you lift it off and come back to this area, and then with the next movement, you go slightly sideways to end up in the same position again on the neck, then move over to the other side and do it till you finally got all the areas covered. And the upper point of your movement is the ears, of course, the earlobes. Once you're there, this is your final pathway there. And all.
Electrode.
Pardon?
You need electrode. I have electrode. Yes.
To show.
Yes.
Yeah, well, I haven't got a patient to show. But
Yeah. I have electrode.
okay, shall we demonstrate it on? We need Andreas again.
Okay, you may continue the theory, speak about few minutes, Margaret come just with electrode and you can make demonstration. Okay,
Okay, very good. Turn it off in the meantime.
Okay.
That's good.
let's continue. Continue theory. Человек с открытым черепом был бы красивым. Был бы человек с открытым черепом, видимо.
У нас есть Антон или?
Антон, да. Позвольте.
Да можно, все равно ничего не будет.
Кстати сказать.
Нормально, пару слов скажу.
Next. No. The next slide. Maybe this slide, good first slide.
Okay.
This information.
Okay. Yeah. Good idea. Yeah.
Warum good
Yeah.
this work?
Yeah.
Huh?
Yeah. It's the slides I got from you. Yeah.
Second slide.
Yeah.
Куда там? О, ладно. First slide.
Yeah.
Yeah. Okay. Second slide.
Yeah.
30 slide. Yes.
So I put this one, then this, then this.
Maybe this technique, this variant. Next slide.
Okay. So you mean like
Yes.
that? Okay. This, and that. Yeah, that.
Good.
Good.
Big.
Yes, I thought this is actually, that's not a good electrode because you cannot use it for D1. The cable is too thick, it doesn't read. But something like this, a little bit tilted with a longer handle that could measure IR would be great. You can work on here and do little wings with it or that and measure, and you could start putting it on there, flip it over, flip it over, flip it over, and get your IR readings. I have to talk to Yuri whether he makes one like that. This is from the SCENAR people. Yeah.
Он сказал, что очень сильно занят. Он работает с этими.
Maybe this electrode different.
Yeah, could be like that too. Yeah,
Eyes.
yeah, yeah. But certainly, what is good thing is actually this two sort of bent downwards, coming up like that, and then a longer handle, and you can really work on patience here. That would be good.
Longer.
Yeah, treat yourself. Exactly. Yeah, that's why I brought this. So I wanted to talk to Yuri about it.
Я так понимаю, есть свой прибор. Понятно. Придется мне принести.
Сейчас. Right moment. This one electrode is not smart.
No, it's like right on.
It's good, but
Вот original.
Пускай физикается. Просто.
Когда я бежала, обратно, не понимаю,
Наименьший нам надо следить, чтобы емкость была минимальной. То есть у нас находится этим самым, называется, с тестером, который емкость идет, Сережа, принеси без этого. Совершенно шестьсот, скопиливается, берется, выпустит, сканфасирует. И монтируется так, что 605 туда вставляется один на один.
Я помню.
И получается, вот прям выше, чем середину, там же медленно.
every day.
Правильно, красиво. Без символии.
Просто я сомневаюсь, что тем электродом возможно...
Правильно сомневаюсь. Правильно. Я как человек, который первым начал применять произнесенное, говорю, правильно. Я тоже
Можно сюда? Уже там раскрывается.
техник. Где будем чесать? Окей, там, здесь, там. Опять.
А прочеркнул волосы?
Еще он постарается.
Ну, в крайнем случае можно изобразить терапию.
Это будет. Давай мне.
Вот это вот не закрываем. Здесь. Так, и на перечень.
Just testing.
Okay.
Oops. It's turned off. Good. Okay. Ready to go?
Are you ready?
Please stand.
Я забыла. Извините.
И
Okay.
сидишь.
Good. Let's demonstrate how the craniotherapy works. For that, because she's not shaved, and we don't want to shave the beautiful hair, we use a comb electrode that is roughly the size of the built-in electrode. And what I'm doing now is, the energy is on 1. I place it on her forehead. It's on 1. I put it on there, and I turn it up. Tell me when you feel it.
More. 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 Stop.
Okay?
Okay.
Good. So, we take the electrode, place it on the forehead, and hold it for a few seconds. And then slowly start dragging it backwards all the way to the base of the skull and hold it on there. The next movement, we start again at the forehead, and this time I venture out a little bit to the left and move it all the way in a curved pathway all the way to the base of the skull and hold it. And now I come again to the forehead, and this time I go out to the right hand side. And again to the base of the skull in the middle. Can you still feel it?
What?
Can you still feel it? Tingling?
Yes.
Yeah, good. Okay, and I come again to the front. And this time I go even further out. Till I reach the base of the neck, of the skull.
And you should show from side.
Okay.
Oh yeah,
This turn.
turn around a little bit. So now you can see that I'm
Okay.
going a little bit further down than I did before. Sometimes you have to go in several goes because the hair is so thick that you can't go through with this comb. And the last pathway on this side here is just above the ears. The earlobes are here. So I go over, just go over the earlobes, and move it all the way back. And the last one will be the same on this side here, just above the earlobe, all the way down here. So you can do this once, you can do this several times, and we would use it for any neurological disorder. It is a particularly good one to use in patients who had a stroke, where you would start on the not affected side of the skull and then work your way to the other side of the skull that is affected. You can start in the midline and move downwards towards the ears and as far as you can behind the ears. That's another variant of doing the cranial therapy. Thank you.
Thank you.
Еще профессор.
Thank you. So as you can see from this anatomical drawing there, that you're actually covering quite a lot of areas that are important, especially when it comes to stroke patients there. Here's the motor cortex that you go over. Focus areas often affected when people have got strokes there. And you cover basically the whole brain there and set different impulses to the skin that make the brain react to the SCENAR signal. So that's the watermelon that we just demonstrated, and variations are these ones there. I hardly use this one here because I haven't got many patients who are nicely shaved on the head. Okay, those people who know auricular therapy and are firm about ear acupuncture, there are different diagrams around which are important points for auricular therapy. However, using a probe electrode, have you got one here? A probe electrode. There are two different ones around. There's a straight one and there is a bent one. Both can be used actually to activate certain parts of the body from the earlobe, the same way as we would use reflexology therapy. And of course, this can be done on the hand and the feet as well. In SCENAR therapy, we prefer Jorg therapy as reflexology, as reflex therapy, where you can actually stimulate certain parts of the hand that relate to different organs deep inside the body. Okay, and after the break, we will start and look into the dose 1 mode and how to treat with using dose 1 and numbers, which is a little bit trickier. So we do this after the break. Okay,
Now break.
we have a break.
Okay.
Yep, and after the break, we do dose 1 mode.
Okay.
Okay?
It's right.
When?
It's right.
Okay, we stop translation.